Hi, everyone. Welcome back to the Counselor Education series on theory. In this mini lecture, I'll be diving into cognitive behavioral therapy, or CBT, which is one of the most widely used evidence-based approaches in the field. And so whether you're studying for the NCE or building your clinical toolbox, this one's definitely essential, especially for those who are building their theoretical foundation as well. So let's get started. Cognitive behavioral therapy was developed in the 1960s by Aaron T. Beck, a psychiatrist who noticed that his depressed clients often had automatic negative thoughts. His work marked a major shift from the psychoanalytic models to a structured, time-limited approach grounded in cognition or thoughts. CBT is built on the idea that thoughts, feelings, and behaviors are interconnected. When we identify and challenge distorted thinking patterns, we can create meaningful changes in emotional and behavioral functioning. Another foundational figure within this paradigm is Albert Ellis, who developed rational emotive behavior therapy, or REBT, in the 1950s. Ellis focused on irrational beliefs and how disputing them leads to emotional change. Both Beck and Ellis emphasize that changing thought patterns can change lives. There are several hallmark features of CBT, automatic thoughts, cognitive distortions, and core beliefs and schemas. Automatic thoughts are immediate, often subconscious thoughts that we have about a situation. Cognitive distortions are common thinking errors like catastrophizing, black and white thinking, and overgeneralization. Core beliefs and schemas are typically deep-seated ideas that we hold about ourselves, others, and the world. CBT helps clients identify, evaluate, and modify these patterns. A typical CBT session includes agenda setting, homework review, cognitive restructuring, and behavioral experiments. Cognitive behavioral therapy is a highly structured and goal-oriented process, making it ideal for short-term treatment plans and easy to integrate with measurement-based care, a big plus in today's managed care environments. So let's talk about the evidence base. So CBT is one of the most empirically validated forms of therapy. It has shown consistent effectiveness for treating depression, anxiety disorders, post-traumatic stress disorder, substance use disorders, and even chronic pain and insomnia in some cases. The American Psychological Association, or the APA, considers CBT a well-established treatment for multiple conditions. And if you're taking the National Counselor examination, remember CBT's empirical support and structured format makes it a top answer when questions ask about effective treatments. So let's talk about CBT in practice and within the context of counselor education. And this would go similarly for other types of mental health professional training, such as clinical and counseling psychology, marriage and family therapy, clinical social work, and others. CBT emphasizes client empowerment and skill building. It works well in diverse settings such as schools, community agencies, and in private practice. And it aligns with ethical standards due to its transparency and use of informed consent. Cognitive behavior therapy also pairs well with culturally responsive counseling when adapted to the client's worldviews. For example, culturally adapted CBT has been shown to improve outcomes in marginalized minority communities when values and language are integrated. And this was according to Hinton and Jalal 2014. So let's talk about the NCE and test tips as they may relate to cognitive behavioral therapy. So remember, when we're thinking about Aaron T. Beck, Beck's focus in depression and automatic thoughts led to the development of CBT. Whereas Ellis and his REBT was connected to irrational beliefs and the ABC model, which links that back into this particular paradigm. And the ABC model stands for activating event, beliefs, and consequences. Remember, CBT is time limited, structured, goal oriented, and evidence based. And the key techniques within CBT often include thought records, behavioral activation, cognitive restructuring, and exposure therapy. So, for example, if the NCE asks which theory is most supported by research or best for treating depression and anxiety, CBT would typically be your go-to answer. And so that wraps up our mini lecture on cognitive behavioral therapy, especially as it relates in counselor education. And so we'll want to stay tuned for more theory breakdowns, and don't forget to like and subscribe to the channel for updates, especially if you found this to be valuable. And until next time, remember that if you change your thoughts, you can change your life, according to Beck and Ellis, as well as others. Talk to you soon.